Hello everyone and welcome back to MediNotes from Medicos. The topic that we're going to deal today is about ACE inhibitors from pharmacology CBS. The objectives that we're going to deal today over here is introduction, the mechanism of actions, other effects, routes of administration, adverse drug reaction, contraindications, drug interactions, uses, common drugs, captopril and enalapril. So what is ACE inhibitors? ACE basically stands for angiotensinogen converting enzyme, and the inhibitors that inhibits this enzymes is known as ACE inhibitors. It is used as an antihypertensive drug. So what is the mechanism of action? We clearly know that this kidney, it releases renin. So the angiotensinogen over here in the presence of renin forms angiotensin 1, which is an inactive stage. So in order to convert into angiotensin 2 over here, it needs angiotensin converting enzyme. So once this angiotensin converting enzyme is in action, it forms angiotensin 2. This in AT1 receptor, it causes vasoconstriction, aldosterone release, sodium retention, pro-inflammatory actions, oxidative stress, proliferation of smooth muscles or myocytes, and this causes an increase in the blood pressure. So this ACE inhibitors over here, it inhibits ACE. Once the ACE is inhibited, it does not form angiotensin 2. So no formation of angiotensin 2 leads to the vasodilation. This causes a decrease in the BP. So what are the other effects? It causes a decrease in the degradation of bradykinin because it's a vasodilator. It increases the synthesis of prostaglandins because it's a vasodilator. It reduces ventricular and vascular hypertrophy. What are the routes of administration? Usually we give ACE inhibitors orally, but in cases of emergency, there is only an IV that we give, that is enalapril. What are the adverse drug reactions? Dry cough is the most common one over here. It is the most important adverse reaction that is seen in ACE inhibitors. It is because of the increase in the level of bradykinins. And angioedema, this would further lead into the airway obstruction. During pregnancy, it causes teratogenicity, rashes and itching, hypotension following the first dose, dysgeusia, hyperkalemia in patients having renal insufficiency or who is undergoing a treatment of potassium-sparing diuretics, proteinuria and neutropenia over here. Proteinuria and neutropenia are the two adverse reactions that occurs very rarely. What are the contraindications? We won't give ACE inhibitors to patients that is undergoing bilateral renal arteriostenosis and pregnancy. In drug interactions, we would never prescribe a drug of ACE inhibitors along with potassium sparing diuretics because there is a high chances of causing hyperkalemia, which would worsen the situation. Lithium would cause lithium toxicity, and thiazides would decrease further the blood pressure, causing a state of hypotension. So what are the uses? It is used in hypertension, in acute myocardial infarction, congestive cardiac failure, diabetic nephropathy and scleroderma renal crisis. This picture over here I have given it as scleroderma renal crisis. So what are the common drugs that is used in as ACE inhibitors? Captopril, enalapril, lisinopril and perindopril. So I made a mnemonics over here, that is pril can't eat lasagna and pickle together. Okay, I know that lasagna and pickle is a weird combination. It would never go together. So that's the reason. Pril can't eat lasagna and pickle together. Pril over here is a suffix of ACE inhibitor drug. So any drugs that has a suffix in pril as pril over in it, it is an ACE inhibitor. So we add pril in the last of every drugs, and then C. C stands for capto. So captopril. E stands for enala. That will be enalapril. L stands for lisino. That would turn into lisinopril. P stands for perindo. That would be perindopril. The next topic is captopril. So it is given as oral administration. 4 doses are available: 12.5 mg, 25 mg, 50 mg and 100 mg. So the administration is, it is taken in empty stomach as it reduces the fat absorption. Indications are acute hypertension. We will be providing them 12.5 to 25 mg per oral and repeat as it is required. In congestive cardiac failure, initially we'll start with a dosage of 6.25 to 12.5 mg per oral and repeated 8 hours. Every 8 hours. For maintenance, we'll be giving them 25 mg to 125 mg per oral every 8 hour to 12 hour, and the maximum dose that can be given is 450 gram per day. Diabetic nephropathy, we would be giving them 25 mg per oral every 8 hour. The next topic is enalapril. It is a prodrug. It has two indications, one being hypertension and the other being heart failure. So the dosage over here is, initially we would be giving them a dosage of 5 to 25 microgram once in a day, and if it is required, we'll be increasing the dosage to 40 mg once in a day. As maintenance dose, we'll be giving them as 20 mg twice in a day. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. We'll be coming with more videos. Till then, stay tuned. Happy learning. This is Ashna Viraju signing off for today. Bye.